Ely 1, Addie 2, Sophia 3.
4, 5.
Hello everyone, my name is Rachel Choate and today I will be talking about schizophrenia. Every year, millions of people are diagnosed with this disorder, schizophrenia. Spreading awareness about schizophrenia can be powerful in many different ways. The more that people know about it, the less of a stigma, the more people can get help, get diagnosed, and receive treatment. The subject of schizophrenia interests me greatly because one day I would love to become a psychiatrist and help people with this disorder and many other disorders. Let's start with the different types of schizophrenia. According to mentalhealthuk.com, there are 8 different types. The 8 different types are paranoid, hypophrenic, catatonic, undifferentiated, residual, simple, synestopathic, and unspecified schizophrenia. The list isn't inclusive and many people can be diagnosed with some other different form because schizophrenia, just like any other disorder, affects people differently. Schizophrenia looks different on everyone, and that's why there are so many different forms. Schizophrenia is the most common. Paranoid schizophrenia is the most common type. It can affect people in many different ways. The paranoid schizophrenia symptoms can be hallucinations, delusions, and other common symptoms that can be seen in other different forms of schizophrenia. Common symptoms of schizophrenia that Rethink.org describes are hallucinations, delusions, disorganized thinking, lack of motivation, slow movement, change in sleeping patterns, poor grooming or hygiene, change in body language and emotions, and less enjoyment in social activities. The symptoms of schizophrenia can be debilitating and exhausting to anyone, which is why it's important to have a diagnosis and treatment. If a person is treated for schizophrenia, if a person is not treated for schizophrenia, the symptoms can worsen and it can be extremely dangerous for the person. A person with schizophrenia can live without medication, but it can make the person more likely to hurt themselves or to commit suicide. Paranoid schizophrenia is the most common type, but the rarest form of schizophrenia is catatonic schizophrenia. Catatonic schizophrenia is extremely complex, and there are many different signs and symptoms of it. Brown.edu describes there being 2 different types: stuporous catatonia and excited catatonia. People with catatonia are unable to move in a normal way that people would describe as normal. Occasionally, patients with catatonia, schizophrenia, exhibit catalepsy or waxy flexibility, stated by Brown.edu. People with catatonia can have different symptoms that you can see physically, as well as ones that you can't see that are emotional and mental. A very common symptom is stupor. Stupor is a very serious mental state in which the person is unable to respond to any sort of stimulation, verbally or physically. This could be physical touch or holding a conversation. This leaves a person to become something similar to having unconsciousness. Other symptoms that Brown.edu describes for catatonia can be catalepsy, waxy flexibility, negativism, or mutism. These symptoms all have to do with the way that a person responds to verbal and physical stimulation. Limbs staying in the same place that a person puts them in, lack of response to verbal instructions. All of these symptoms are responses to stimuli or lack thereof responses to stimuli. There are symptoms that can, of course, worsen if not treated. Schizophrenia is challenging for anyone who has it, and it's also very difficult for family members to see their loved ones go through something as difficult as schizophrenia. This is why getting help, having a diagnosis, and getting treatment is so important. Last year, the National Institute of Mental Health described many different options for treating schizophrenia. After being diagnosed by a doctor, a person can is supposed to go through several diagnostic tests, like blood being drawn, to make sure that there's no other illness that they're going through. So if a person goes through these blood tests, it's to make sure that there's no other illness that they could go through that may act like schizophrenia, and you want to make sure that you have the right treatment. Treatments for schizophrenia include medication, psychological counseling, and psychological therapy. Harvard Health in 2019 describes medication used in treatment of schizophrenia as antipsychotic drugs. There is no way to predict how a person will react to treatment, and that is because of all of our unique genetic makeup and the different ways that our bodies are wired. Because of these different ways that our bodies are wired, there is a huge trial and error process to this, which is why it is imperative for a patient to be committed to the treatment and persevere when things get hard. That is so that the best treatment for that individual is found. Usually the combination of medication and therapy is the best way to treat a person. Many people may not want to seek treatment for many different reasons, as in unable to afford the cost of treatment, and that is because when having schizophrenia, it is extremely hard to keep a job because their mind is in so many different places that they are unable to think about the job in front of them. Another reason why someone may not want to get treatment is because they think that they are perfectly healthy and do not need to receive treatment, and that is extremely common when having schizophrenia. In conclusion, schizophrenia is extremely hard to deal with, and it is important to support others with the situation that they're in. Thank you. Ely 1, Addie 2, Sophia 3.
4, 5,